Sally, a new disease investigator at the local health department, is being trained by her supervisor, Evelyn, to investigate cases of reportable communicable diseases. She has already learned a lot about the regulations that give local health departments authority to investigate diseases. Sally is learning how to use the New Jersey Communicable Disease Reporting and Surveillance System, also known as CDRSS. It is a web-based secure system which is used to track information associated with public health disease investigations. Both state and local disease investigators have access to CDRSS. Most cases come in electronically from laboratories. This is known as ELR and stands for Electronic Laboratory Reporting. Individuals who have positive laboratory tests are sent automatically to CDRSS. It includes patient information, lab results, and other helpful information. ELR is not the only way that cases are reported. Some laboratories that do not have ELR will manually enter positive laboratory tests directly into CDRSS. In addition, paper lab reports are sometimes received by fax or mail. In this case, they must be added manually into CDRSS by the investigator. Before Sally can use CDRSS, she must be trained. The training will be interactive by webinar with poll questions and a live Q&A at the end. New users should register for the CDRSS General User Training session by doing the following. You can register for the training on CDRSS website at the web address provided in your user guide, also shown on this screen. Select your preferred date of training from the drop-down list, complete the user agreement, and send it to CDRSS admin team. The preferred option is to scan the signed user agreement and send by email to the address shown on the screen. It can also be faxed to 609-826-4750. Within 2 hours of finishing the webinar, you will be emailed a link to complete an online post-test. Your access to CDRSS depends on getting a passing score on this post-test. If you don't get a passing score, the CDRSS admins will contact you to determine next steps. New users must also sign a data use agreement, which means that they agree to use CDRSS data for public health purposes only. In New Jersey, only positive laboratory results for reportable diseases are required to be reported to the state and to CDRSS. Local health department investigators only see cases that reside in their jurisdiction, while state investigators can see cases in all areas of the state. In New Jersey, the rule is that the local health department that covers the town where the patient resides has jurisdiction and is responsible for conducting the public health investigation. Sometimes the laboratory does not know the patient's address. In this case, a local health department may see the case in CDRSS if the healthcare provider or hospital who ordered the test is in their jurisdiction. Adding the correct address for the patient will automatically place the case with the correct local health department.
I'm concerned about privacy. Who has access to CDRSS and can see this data?
Good question. Only public health and our healthcare partners have access to CDRSS. Our main partner in the hospital setting is the infection preventionist. They use the system to document information relevant to the public health investigation when a person is hospitalized.
Now that Sally has access to CDRSS, she's ready to use the system to investigate cases of disease. Every day, Sally should log into the system to check new cases that need investigation and follow up with old cases that may need additional follow-up or to be classified and closed out. It should be noted that some diseases take priority over others. Diseases that are immediately reportable, such as hepatitis A, measles, foodborne intoxications, botulism, and the bioterrorism diseases require immediate public health response. Outbreaks are also immediately reportable and should take priority.
When should an investigation into a communicable disease begin?
Great question, Sally. It really depends on the disease. If it is an immediately reportable disease or an outbreak, then investigation should begin right away. But if it is a reportable disease, ideally you should investigate as soon as you can, definitely within 1 week of it being entered into CDRSS.
Once in CDRSS, you will notice that some fields are required and are marked with a red asterisk, while others are important and are marked by a blue asterisk and should be completed if the information is known. This information is important and should be updated if at any time during the investigation this information is determined. In CDRSS, each disease has sections which will automatically appear, and these are critical to complete. Critical fields include the following variables: demographics, signs and symptoms, clinical status, laboratory information, patient location, and risk factors appropriate for disease investigating. It is important that you complete as many fields as you are able, especially race, ethnicity, and risk factors. It's important to get this information even if it's not readily available in the initial report. This gives us better information about groups who may be more likely to contract the disease and have certain risk factors, such as injection drug use for hepatitis C cases. The goal is to have a complete case record. This means all the critical fields and demographic fields, including risk factors, are complete. Sometimes you will notice cases that are the same person. You will know this because the person's name is similar, but they have the same birth date or a repeat lab test. If you are sure that this is a duplicate case, you may merge the case. You can find more information about merging cases and deduplication in the CDRSS online training.
How can CDRSS data be used?
CDRSS can also be used to determine if unusual disease activity or an outbreak is occurring. Running disease statistics can help by comparing the number of cases to a similar time period in the past. This is why it is so important to get as much info about the patient, their exposure, and risk factors as you can. If a field exists, it is better to select from that drop-down or click on the radio button rather than placing the information in comments. Doing this allows for data analysis of that information. Otherwise, information generated may get lost in the comments as these are not able to be analyzed.
Sally is excited to use CDRSS during her public health investigation.
This is something that they don't teach us in school. We learn about why getting a complete picture of the patient is important, but I never realized that there was an entire system that stored the data and was specific to disease reporting and surveillance. Public health really has cool tools to collect and investigate diseases. I can't wait to get started.